And today's speaker, Dr. Melanie Baram, I really, thank her that she could able to make herself available for the talk today, although she's on vacation or holidays, probably. So about Melanie, I mean, she's an OVC grad, and she completed following to graduation. So she completed a private practice internship in Southern California. In the performance horse practice. Then she returned back to Ottawa, area where she grew up, and she joined AHL in July 2014. So prior to joining AHL, so she was very actively involved in private equine practice at Campbellville area. Is it correct? Okay. So Melanie has completed training in small animal and equine acupuncture, so which is very interesting, I thought. And she has served as the president of Ontario Association of Equine Practitioners, and she is also an FEI level veterinary delegate and served as the drug testing veterinarian at the Pan Am Games 2015 in Toronto last year took place. And she is currently the chair of Equine Canada Health and Welfare Committee, and she joined the AHL for the Animal Health Network to look after the network activities as the coordinator, which she is going to talk about it. And she has enjoyed working in all the aspects of agriculture sectors, including animal agriculture, which is poultry production. And in her free time, she enjoys spending time with her husband and young daughter, and she's involved in various activities such as hiking, camping, cross-country skiing, cycling, as well as riding her horse. So with this brief introduction, I would just let Melanie.
Hi, thanks so much, and I apologize for being late. I am off today, so I was driving from the north end of Guelph, and there was an accident, so my office is actually just over there, so I really don't come from very far away. But anyways, so you might wonder why someone who's involved who has such an extensive horse background has come to lecture to esteemed poultry researchers. And so in my current role, I'm the coordinator, and so really I will tell you right off the bat, I'm not, as you can tell from my history, I'm not a poultry expert, but my role as the facilitator and to talk to you today is to kind of bring things together for this poultry network, to bring the expertise together, and that's really what OWYN is all about, is sharing expertise and asking opinions and trying to get a state of what is going on in each sector and disease-wise. So I'm going to give you a little bit of background on the Ontario Animal Health Network, objectives of our model, and then what we've had some applications that we've used and some of the outcomes that we've seen in the past year that the poultry network has been in operation. And then some of the research projects, the 2 research projects that we're working on, and some of the OVC community involvement, and happy to take questions throughout the presentation. So some of the background on the Ontario Animal Health Network. This is the vision and mission, public trust and confidence from a collaborative animal health network in Ontario. Coordinated preparedness, early detection, and response to animal disease through sustainable cross-sector networks. So you'll notice networks, not just poultry. So we do have a network for each species across Ontario, including fish and bees and horses and basically anything that's considered an animal, we have a network for it. We even have alternative species, and we have along with all the major agricultural groupings. So the funding that we have for this program comes from provincial and federal Growing Forward 2 money, as well as a lump sum from OMAFRA, and it totals $1.3 million per year over the course of 5 years, 2013 to 2018. And it's kind of funneled into this to the disease surveillance program, which is our parent program to the Ontario Animal Health Network. There are several parts to the DSP. There are 4 pillars to it, which we'll talk about in a second, and OWYN is one of the big parts, and it's really a partnership between OMAFRA, the University of Guelph, and the Animal Health Lab, as well as private industry. So this very, very messy slide, don't worry about it too much, is really just some of the things that have happened as we've gone along through the network. So really our very first year, 2013, was getting the funding, figuring out a model that might work for surveillance in Ontario, because the DSP was tasked with improving animal health surveillance in Ontario, which sounds very broad and very vague in a way. So they had to kind of do an environmental scan, figure out what was out there and what might work for Ontario together, and putting that together with some of the what the stakeholders wanted across all of the sectors. And you can imagine how different that might have been across all of the different parts of agriculture. So they came up with a model that was largely based on Quebec's model, which is called RAISO, which is a play on words. Is RAISO in French is network. So it's RAIZO, and it's just an acronym but it sounds like RIZO. So that was the first year. Second year was kind of getting started. So we started with small ruminants. We moved on to get fish, equine, bees, and then poultry in February of 2015. And then all of the networks were established by September of 2015. Poultry, as I just mentioned, was started in February. So we have a full year under our belts. So we have an idea of what it does look like now, but it's, I guess, it's always a work in progress and continual change and improvement. So this second year, so 2014 was developing the networks and getting our veterinary expertise lined up. And then our third year has really been about maturing the networks, figuring out how we can get our arms around these 10 networks and what they might all look like, and reaching out to industry and making sure that we have some connection with them and some better, I guess, way to take the information that's gleaned from the networks and take them not just to veterinarians but also to producers and producer groups. So that's what this year is all about, and then next year we'll probably have more of a focus on maturing the networks and kind of deepening those ties to both groups, veterinary and producer. So these are our 4 pillars of the parent program to OWYN, Disease Surveillance Plan. So one is this environmental scan, consult and engage stakeholders. So that involves having annual meetings. It involves continually talking to our producer groups, continually talking to our veterinary groups, and making sure that we are actually fulfilling the mandate of the program to improve animal health surveillance. Are we doing the right thing? Are there things we need to be doing better or different? And that's, I think, a nice thing, is that it is a continual improvement process. It's kind of a nice, and it also improves your relationships as you're asking those questions. The Enhance Ontario Surveillance is really mostly about OWYN. We're kind of one of the legs of that 4-pillar table, and a large leg, I would say a fairly meaty leg. Then integration with national surveillance is another portion of it. So we're part of the Canadian Animal Health Surveillance System, which is newly formed over the past year. And we're part of various national programs to try to take the information that's developed and maintained in Ontario and share it nationally where appropriate. And then the other part is developing better tools for managing risk. So this can be things like getting better equipment for our lab. It can be things like hiring the right people to staff the lab, or developing IT solutions that might be better to manage risk and to get better samples in through the lab. There's all different kinds of things, or they might be research projects, which we'll talk about a little bit later. So our pillar 2, this is our basic structure for our OWYN networks. For all of them, they have this kind of basic model, and then we work from there because it doesn't always work for every species. For example, in fish, there's only 1 private veterinarian, so it'd be very hard to have this group of 7. So what we do have is, I'm the coordinator on all of them. We also have a species pathologist from Animal Health Lab for all of them, an OMAFRA species specialist, and sometimes there's 2 or 3 from any of these groups. We try to have at least 1 representative from each of our AHL, OMAFRA, and OVC. And then our OVC species specialist. And in with OMAFRA, there's often ag development branch people, such as Al Dam is on our poultry one. And then we have up to 3 private practitioners. And in poultry, we're very lucky because we were able to make the case that since poultry has 4 very distinct portions to their industry, we were able to get 4 people. So we have funding to do that. So those practitioners participate on our quarterly calls as well, and they're involved with all of the activities. And they're chosen from their peers. They're self-nominated, and then we ask, we have a final selection committee, or in some of the groups really felt strongly that they wanted to have a vote from among their peers. So we did that. It just depended on what the group felt comfortable with, that they would believe in this, they would believe that these people were really representing their true interests. So it really depends on the culture of your group. So some of the applications of OWYN that we've found in the past year for poultry, this is the one that I think of the most, which is our avian influenza outbreak. So again, this is kind of this is a larger timeline. So in December, we knew that there was avian influenza in BC. And of course, the Ontario industry was very concerned with that. We had our poultry vets from the Ontario Association of Poultry Veterinarians on board, and they were interested in getting the process started of starting an OWYN network. So what we did before Christmas break was we got everyone together who was interested. So private veterinarians, OMAFRA, industry was all invited to a conference call, and we had an emergency preparedness call to talk about who would do what if there was, in the bad event that there would be avian influenza, and we were all keeping our fingers crossed that it wasn't going to come to Ontario. So OWYN distributed some important phone numbers for the industry, and OMAFRA shared what their role would be, some of the stuff about Incident Command Center, Featherboard Command Center kind of clarified their role, and just, it may have been slightly redundant, but I think it was nice to sort of just say, okay, here's what we would do, here's what we would do, here's what you should do if you see something bad, and here's the important numbers to call so that you could post them in your barn, you could share them wherever you would like. Then in February, we had our first poultry call, which was great. And I have to say that our OWYN poultry group is very, very engaged. We have there's 11 private practitioners who practice in Ontario full-time on poultry. And we have all 11 of them completing surveys every single time, which is really phenomenal. So 100% return rate. So if any of you have ever done surveys in your research, you know that that's pretty good. And I will tell you it's great. It's it's our best statistic across all of the OWYN network. So I'm very proud of that, and our group is really, really very good. And then Easter Sunday came, and we had avian influenza confirmed at AHL. And then it was confirmed in Winnipeg, at the Winnipeg lab. So the Monday, we had some calls internally with OMAFRA and with CFIA to determine roles and who is going to be doing what. And then on Tuesday, we had a poultry network call to determine. It was just that group of 8 people, and it was really just to determine a gap analysis. So where we know that CFIA is doing a great job at looking at and they're going to be taking the lead. And then OMAFRA is going to be playing the supporting role, and they're taking care of all of those things. So where are the gaps? Are there things that this group could fill? Are there things that this group needs to look at or could develop? So the thing that they really felt was that our small flock guys would benefit from some outreach, and they might be our spot where they may not be reached by some of the larger campaigns. So what we did is we released our avian influenza information sheet, which had come out of our first OWYN poultry call, and we re-released our important numbers for the poultry industry. And then we started on our small flock stuff that maybe would help, and largely with the help of Al and some help from Shaba Varga, who's our OMAFRA co-lead. What we did is we tried 2 things. So one was we went on radio. So it's kind of like going from the Stone Age to the Space Age here with our 2 technologies, but very similar and kind of the same way to reach people. So we went on some farm radio shows, myself and Al, and then sometimes Al separately, because Al, as you know, is a one-man communication show in the poultry industry. Everybody knows your number and everybody knows to call you. So we talked a little bit about the risks and what people should know about avian influenza and who they should call if they saw any of the clinical signs that we outlined. And then we did the same thing on our podcast. So usually the radio shows would be 2 minutes or less, so trying to cram a lot of information in there. So what we did is we referred them over to the podcast. And the podcast was a longer recording with myself and Alan, had lots of input from our other poultry members. So Marina helped, and so did Shaba and many of our other group, to try to make sure we'd covered everything, to try and look at it from a small flock perspective. And that was fairly successful. We had over 1,000 listens to that podcast during that time, which was it's a lot considering it's kind of a niche situation, and they sort of may have heard of it from various places. This was our info sheet, which again it contains an awful lot of information in a short amount of time. Lots of technical information. I don't expect you to read it, but just to show you this is what it looked like. It's fairly wordy. So what we also tried to do is, because we know that lots of people don't love to read, and it's hard to get them to sustain some interest in something that maybe isn't that interesting to them. So we tried to take it and make it into something that they would like to read a little bit better, or they might feel comfortable posting in their barn. So these were our infographics that we also released. So the same information that was on the wordy info sheet, we put it onto these infographics. And we put them double-sided. So there's biosecurity and avian influenza. And we put them one on either side. And then there was also a room for you to write your veterinarian's name down and any emergency numbers. So we hoped that people would post them in their barns, and we had them, we just had them via paper first, and then later in the year we had them available that were laminated, which was Marina's great idea. So we had those ready for release, and we've printed and distributed over 500 of those so far, and we still get requests for them, which is great. And I was encouraged to see that when I searched on Google small flocks, this was one of the first things that came up on my page. So maybe Google knew that I had posted it or something, but trying to make me feel good. But it was there on the first bit, so that was kind of nice to see. The other application that we recently tried out and I think was successful was our small flock veterinary training. So the other part that we noticed during avian influenza outbreak was that we didn't know how to get in touch with small flock veterinarians, and who would these small flock people be turning to. So it's one of the questions that I think are perpetually out there for the poultry industry, is how do you get in contact with small flock people? How do you get in contact with their small flock veterinarians? If they have a veterinarian, who would they be turning to? Small animal vets, large animal vets? So we decided to put this out here, the small flock poultry training. This training was done, I think in 2002, was it, Marina? 2009. So it's kind of a repeat performance that was with some updated, refreshed information. We were able to offer it for free for any veterinarian who wanted to attend in Ontario, and we also live streamed it to people who wanted to attend at home. So we had 37 veterinarians in attendance, and some had gathered in clinics. So there was 4 or 5 people around kind of a hub at a high-speed connection at a clinic, and they just watched via YouTube. And I think they were quite a large and engaged group, and they had lots of great questions. So there was a lot of interest, and many people had said, oh, I want to attend, but I can't come that Saturday because I'm working or what have you. So we also have made it a legacy project, and it's available on our website for any veterinarian to view. They just have to sign into and have an OWYN account, which is open to any veterinarian in North America to have an account. So that was kind of an interesting day. So we had lots of great speakers. We had, again, Al talking about an overview of the industry and practical biosecurity. Dr. Vargas spoke about OMAFRA's role during outbreaks. Dr. Mike Petrick who's also on our OWYN network, spoke about practical euthanasia techniques, and that, of course, for a small flock veterinarian is really important to know, because oftentimes what the participants told us is that they're getting calls, and as everybody here knows, poultry don't often show their illness very well, so they're maybe getting them, and you're maybe dealing with beginner farmers, so you may be getting calls later than an experienced poultry person. And then Dr. Lloyd Weber gave an excellent talk about about managing by the FLAWS principle, so looking at management styles and looking at management issues, and then also actual disease issues. And Elizabeth Black, who is another private practitioner from Ontario, talked about vaccines and medication. And then Marina talked about packaging samples and about the research projects that are ongoing. So another interesting thing that we did try to do was we live tweeted, and then the other part was that the participants who were listening via YouTube just sent in their questions to me, and then I asked them, and so then they were available. So it was sort of a nice way to have an interactive discussion. So I guess just to go back to this part as well, the other part that we had kind of got involved with avian influenza was that we also realized that any veterinarian might be, and the part of the reason that this day kind of came about was because we realized that any veterinarian across Ontario could be called upon in the event of a foreign animal disease like avian influenza or others. So when that had broken out as well, we had done some outreach to the College of Veterinarians of Ontario, and we had sent a notification to all veterinarians. They were very kind to send everything out to all veterinarians in Ontario. A notification containing some information about avian influenza, what to do if someone calls you, whether or not to go out to the farm, and some questions to ask from the phone, which was developed from some coursework that Dr. Brash had done with, I think, with fourth year class, right? So from all of these things, we've also done, we're also working together with Dr. Susta and many others to work on this disease surveillance in non-commercial poultry flocks. I think this is a fabulous program because it's, again, there's some funding coming from OWYN, there's funding coming from various different places. Basically, if you're a small flock and you have birds that die or are sick, they can submit them to the lab for postmortem, underlining the word postmortem because we don't want them to think that they're going to get their bird back at the end. And they can get a whole suite of testing done for $25, which is really a great price for the amount of testing that they're getting. And they're testing for an awful lot of diseases and also culturing and doing all sorts of, just basically a whole suite. Anything you could hope to do on a chicken postmortem is going to basically be done, which is just lovely. So hopefully, and there's going to be a survey that has been developed. So they have to submit with $25 and their completed survey in order to participate and sign the release. And the survey will hopefully help to hopefully allow us some more information about small flock people and where they might turn for medical information and what their husbandry practices might be in Ontario. Because we know there's an awful lot of small flocks out there. I think the final number is as yet undetermined. And it depends on the breed, but non-quota birds, there's an awful lot of them out there in Ontario. The other research project that is going on, each OWYN network was given the opportunity to apply for $50,000 of funding to look at something that was important for surveillance in their sector. So Dr. Shaba Varga and Dr. Michelle Guerin have put forward the co-leads on the project, and it was developed together with the Ontario Animal Health Network Poultry Group, so everybody had some input. And it's dealing with virulence genes and antimicrobial susceptibility and pathogenic E. coli. And so there's $50,000 of subsidized testing. Basically, when the practitioners submit for culture and there is E. coli, pathogenic E. coli suspected, and then it is isolated, there's additional testing that is done that is paid for, which is nice. So we're hoping to learn some more about E. coli with our Ontario broilers and broiler breeders. I just wanted to share a little bit about some of the stuff that's on our website too for the poultry industry. So on our website we have a login portion. There's a public portion that producers are able to access and any member of the public can access, and that's where our info sheets, our infographics, and our producer reports are present. But you can also log in as the veterinarian and you can get your veterinary reports, because after each quarterly meeting from our poultry network, we take all of the information that's presented, so all of the lab data, all of from AHL, all of the information from the veterinary surveys that we ask the practitioners about, and we put it as well as the condemnation data from Ontario condemnation stuff from OMAFRA, and sometimes we look at the federal condemnation data as well. We take all of that conversation, that 2-hour conversation and all of that data, condense it down into a report, and hopefully make it into something that veterinarians can use. And then we'd also translate that into, we call it the Vet Report Lite, which is our producer report, so that producers can know a little bit about what's going on as well. So what's the state of things and what should they be looking out for, or what things might they think that they should discuss with their veterinarians. So the hope is not that they would see it and think, oh, okay, this is the problem on my farm, but maybe if they hear a little bit about it and hear that this is on people's radars, that they would discuss that with their veterinarian and open the discussion for, is this a problem on our farm? Should we look into it? That kind of thing. So these are our team members. So we have, as I mentioned, many of the people I've talked about today, in addition to Dr. Emily Martin, who's from the Animal Health Lab, Dr. Rachel Ukama, Alex Weiss, and then Mike Petrick, and Cynthia Philippe as well. So those are our private practitioners. We also have Dr. Alexandra Reed, who is our, she works a lot with our condemnation data from OMAFRA. And then Dr. Tim Pasma, who's our lead epidemiologist from OMAFRA as well. So it's nice to have all that expertise on one phone call and be able to draw upon each of everybody's strengths. So we've got, I feel like we've got a lot of brain power on these calls. This was just to show you what our important contact information looked like for poultry. And the other part about our website is that we have been posting notifications from OMAFRA and Featherboard Command Center. Right now it's posted, the Featherboard Command Center posts their notifications on a password protected side, but we post it on our public side so that small flock people or other people who may not be connected with Featherboard Command Center can access it, and any OMAFRA postings. So they are posted on the OMAFRA site always, but they do get taken down after a while, so they're posted in perpetuity on our site, which is nice. So some of the observations and comments from the past year that we've learned from all of our groups to keep our surveys as short as possible, which we knew going into it. So our goal is to make them 5 minutes or less. So they're delivered on an online format, and they get a personal reminder to do the survey. And sometimes we have to follow up with a phone call from someone like Marina, who has a really great relationship with them and is able to kind of coax them in the right direction by hook or by crook. So the survey is nice and easy, and we've checked in with people as we go, with each group as we go along in developing their survey and trying to make it as easy and as, I guess, as logical as possible for their particular sector. The other part that I think part of the reason that the Poultry Network has been so successful is that they already did this activity on an annual basis. They did an annual survey that they use for the poultry producer updates, which I think everybody enjoyed and everybody is part of, and the producer groups have really enjoyed being part of, and they've really benefited from. And the veterinarians have been involved with this for many years. So in a way, it was just a sort of a shortening of I guess of cycle. So we've asked them to do it on 4 times a year instead of once a year. So it's maybe a little bit easier to recall than remembering or going back in your case notes for the whole year of what you saw. So that's what they've told us that they like about it, and I think that's a really positive thing, and that may be part of the success as well. So they were already doing it, so it's just maybe an enhancement or a different way of doing what they were doing. And what we are continually working on is trying to perfect our producer and vet reports to make them as effective and useful as possible, because if we're putting all this effort into doing it, it's important for that information to actually be used in practice or on farms. So currently the producer report is distributed by the Featherboard Command Center, which is great, as their mandate is disease prevention and also and control. So that part, it makes perfect sense that they distribute it to all of their stakeholders and is posted on there. When the vet reports get distributed directly to the veterinarians, which is also great. So we're always working on that, and I think that's as I said, a really nice thing about the program is that there's kind of continual improvement and continual, I think comments are always welcome. So some of the conditions that the network is following, and I'm glad to see Marina and others here, so if there's any technical questions, as I say, as you know from my history, I'm not a poultry expert, so I will turf them squarely to other people. So we have been working on, so some of the things that they have been noting from the past quarters, been tracking the IBV strains. We've had some white chick syndrome and various kind of spurts and spats, so it's been we've been following those and looking and kind of getting some more details on those cases. And I think the lovely thing about the Poultry Network is that our members have been, our practitioners have felt comfortable enough to share a good amount of information, which is great. So they're able to share it in an anonymous way, so it's not saying, well, Dr. Rachel Okuma saw this at this farm. It's very anonymized. Been seeing focal duodenal necrosis and then necrotic enteritis as well, and kind of following those and some of the specifics of those cases and some of the interesting presentations of those diseases. And then last quarter we had some intussusception due to coccidiosis, which was kind of an interesting presentation. and then wooden breast here and there. So to finish up, I just wanted to kind of touch on some of the OVC community involvement. So we have Dr. Michelle Guerin from our poultry group. She's part of it, and she gives an update from OVC, what's going on, what teaching is going on, and what some of the research in their particular part of OVC is doing. But another thing I wanted to share is that across all the networks, we do post social media, on our social media and on our website, we do post abstracts of OVC research papers that have been recently published that practitioners might be interested in. So it's on usually on the password protected side, and it's a link to the abstract. We don't post the full article unless it's a free article that's available readily due to copyright laws. But we're happy to share those things, because one of the things that practitioners have told us across all the sectors is that they don't always have access to journal articles, or they don't always feel that they have a lot of access to it, because journal subscriptions are expensive. So they pick one or two that their clinic might subscribe to, but then the more diverse journal articles, they may not see those on a regular basis. And as everybody knows, private practitioners are super busy, and at the end of a long day, the last thing they're probably going to do is sift through a whole bunch of journal articles in different journals. So if we can kind of bring some of those things together for them, we're happy to do so. So I did want to throw that out there. If there were any research articles that your group is publishing that you wanted to have publicized or put onto social media or onto the website, we're happy to do that. So just send us a link to the abstract, and then we'll put it up. And then we have been sharing the PHRN's work and the fact sheets that have been put out. So we have been using those on our group. So hopefully that's been driving a bit to PHRN. I think it's nice if we can achieve some synergy. And if there's other synergies, then we'd be very open to discussing them. So that was it.
Thanks, Madam, for a very informative talk. So now it's open for questions. And I'd like to request to repeat the question so that
Sure.
it goes into the videos.
I'll ask one. You mentioned cross-sector. Again, I've got background with this, of course, since we're financing.
As the project manager, yes.
But one of the objectives that we're looking at is making sure that we do have cross-sector communication. So a number in birds that could be of significance: influenza, salmonella. How are we doing in that regard?
Yeah, so we look across, so how we have kind of achieved some of our cross-sector needs for that. So our results from the lab always go to, as Grant, so the question was, how are we achieving some cross-sector synergy with things like salmonella and influenza? So a couple of the things. So one is that on the password protected side of the site, veterinarians from any species can look at any of the different reports. And they can also, when they sign up for an account, they tell us what they're interested in. So if they are interested in, if they have a minor interest in poultry, but they're mostly interested in swine or bovine or what have you, we do send them the reports that they want to hear about. So they can look at whatever they'd like. And they are available if they would like to kind of cruise the site whenever they would like. The other part of having the epidemiologists from the province on the call is that they do internally in OMAFRA, they are looking at all of these diseases kind of as a group conglomerate. They have an epi group that looks at those trends, which I think is also a really positive thing. And so Tim will often comment on what's going on kind of elsewhere. The other part is that all of our co-leads from our networks get together on a quarterly basis, and they share information back and forth. So each group says, each co-lead shares what their most recent report focused on and some of the disease trends that they're dealing with, as well as any zoonotic or cross-species issues. So there is some sharing around the table about that. So then the co-leads can delve in afterwards, or they can invite that person to be a speaker on their call, or whatever they would choose. Does that answer, Grant?
I might as well ask you a question. First of all, I was very glad to see that you got very good response from the poultry vets with your survey thing. So I think vets were much better than the researchers in responding. My question was, what are the channels of communication reaching out to producers?
So in the poultry, so poultry industry, when we took a look at across the 4 major boards, the 4 poultry boards, we initially went with the group. We initially sent all of our producer reports to Featherboard Command Center and then to each of the individual boards. What we found was that once we kind of got the report that everybody wanted, the Vet Report Lite that they seem to have responded positively to, Featherboard Command Center said we would really like to distribute this, and the feather boards, what they said is this seems to make sense that FBCC delivers it, so that's how we've gone with it. We do also know that a fair number of producers are on social media, so anything that we post for producers, we do post it to on our website. We post it on social media so that it's another avenue for them to access. So.
And the Poultry Service Association also takes that report and posts it amongst their members. So all the catchers and haulers and other farm service groups get that report also, because they're the ones that are going from farm to farm anyways.
Yeah.
So that's actually worked well. And then what we generate from the poultry or from this also goes into the 6 poultry producer updates we do every year. The information is from that goes directly into the animal health or the poultry health update that's done in each one of them.
Yeah, that's a great point. So I'll just repeat that just so that people if there's anybody there. So so for the poultry producer reports or poultry producer updates, that information is used there annually, and then also for the catchers and all of the kind of associated industry that is distributed to them too. And I think what we found that's valuable from across all of the sectors is that people have told us that it's valuable to hear the information from their veterinarian, but it's also, this is maybe from veterinarians too, is that it's valuable for the producer to hear the information from their vet as a source of information because they have a great relationship with their vet, but it's also valuable for them to hear it in other directions too. It kind of lends validity, and as you know, if you tell somebody something, you have to tell them 7 times, especially if it's something they don't really want to know.
Maybe just following up on that, and I'll have you ask the audience the question too. So we have a Facebook feed, and we have a Twitter account, and we've got 30 or 40 podcasts out there. So the question to the audience is, are you guys plugged in? We've got lots of young, literate people here. We have some older people like Patrick and myself, but so you young folks out there who may be on Twitter, I'm on Twitter, but I don't know how to run it. Is this having an impact?
Yeah, okay.
Like to paraphrase the question.
Sure, okay, so I'm going to ask 2 questions actually. I'm going to add to that. So how many people here have a Facebook or Twitter account? Okay, and are you active on it? Yeah? No, not so much, okay. Okay, so that's interesting. So yeah, and do any of you know did any of you know before this talk about our Facebook and Twitter activities or, you know? Yes, Leo, okay, good, one. I'll tally it up.
That's okay.
That's okay.
Brandon, if I may say something. I don't actually want to disappoint you, but I think, Facebook and things like that are things of the past. The other day I was talking to my student, Adriana, and she said, it must be Instagram.
Yes, that's true.
It's going to have Instagram.
It's true. So yeah, so the comment was that Facebook and Twitter may be dead and it may be all Instagram.
And another series of pictures of grants from all sorts of places.
Yeah, so, and that's something that we struggle with a little bit, is that we're trying to, it's a little bit hard to have pictures of like diseased birds, have them really take off on Instagram. It's not really, that's not as palatable perhaps as a picture of yourself and your dog or something like that.
But maybe I can also tell you
yes.
that I do actually have your podcast for avian influenza, and I do actually even have it, bookmarked on my computer. Oh,
well, that's good. Good to know. Okay, great. Great. So yeah, and I guess the other part that we have done across all of the networks is we've encouraged students to be members of OWIN as well, because particularly, and we've targeted them as they're going out on their externships, because they're going to be spending time with practitioners in the field, traveling around with them, and they're also going to be my main pitch to them was that they're going to be spending 10, 12 hours in a car with a veterinarian, and they're going to need to make conversation. So here's some really good starters, conversation starters. And if you really are stuck for something, then just put on a podcast. Okay, any other questions?
I think you did mention about, like, we are the poultry research, we focus on research network. apart from fact sheets, I think, we can also, in future, like share some of your newsletters, which are, the poultry focus.
Sure, that would be great.
And I think, I see a lot of scope that we can work together.
Yeah, I think it's nice if we can achieve some synergy, and it's lovely that you guys have the. It'd be nice if every group, if every species had kind of a research network. It's nice, yeah. Okay.
Okay.
Thank you very much.
More questions. Join me to thank very much Melanie.